itakusaidia kidogo, but not as much. But when you take it before, it gets the vitamin C's already in, and then when iron-rich food comes in, it's absorbed. And when you're buying your fruit, as we say, do not buy fruits which are exposed to the sunlight. Like we go to in town, buy apples, buy fruits, because when fruits are exposed to the sunlight, when they are on a tree, they are still making the vitamin C. But once they're plucked out, they have that content of vitamin C that they made. So when they're exposed to the sunlight, the vitamin C evaporates. So the more they stay on the sunlight, the more vitamin C content reduces. Wow. So buy fruits which are on the shade. Okay, and there is no need of eating 3 apples, 3 bananas. The fruit salad for 200 shillings, for what purpose? Just a small bowl is enough, or just 1 banana is enough, or 1 apple is enough. So for a pregnant mother, they shouldn't say fruits are expensive. They can buy oranges, they can buy apples, they can buy bananas. But it depends with the challenges they have, because pregnant mothers also have challenges with nausea and vomiting, and that is much on sugary and fatty food, and also due to the hormonal changes during pregnancy that we tend to rectify by diet. And if diet fails, we give you medication to prevent the nausea. Then they also have a problem with acidity, and that is due to just the pressure the stomach is causing, the baby is causing to the abdomen, and just hormonal changes. So we tend also to advise you to avoid acidic foods, oranges, passion, and pineapple, and all that spicy food. And then another monitoring that we'll talk about, what is monitored during pregnancy.
Yes. So I want to remind people of the question of the day here, because already hapo hivyo Felix ametuambia vile tunakula fruits, tuko na mchezo kwa hii town. All right, here's the question of the day. It is, what questions do you have on nutrition during pregnancy and breastfeeding? Felix is here, is going to help you answer them, some of them, the ones that we can in the time that we have. So we would advise that you get on it right now. Start sending in those questions now, then we will sample them, and Felix is going to answer them. What questions do you have on nutrition during pregnancy and breastfeeding? Right, so during, you know, like you said, there needs to be several tests that you do. So you're okay. What are they looking for in this test, in these different stages as relates to nutrition?
Okay, so the first visit of a mother, when a mother who is pregnant visits a facility, the first we'll do is your history. Have you ever had diabetes in your family, or you have it? High blood pressure, miscarriages, how many children do you have? Do you have twins or not in your family? Plus anything that is really going to give us information to help you manage properly. Now, the first thing you'll be done for is weight checkup when you get as a pregnant mother. So weight checkup during pregnancy is very important. And weight checkup is important because you should not lose weight when you're pregnant.
Okay.
Or those who said, I want to stay nice, I want to look good, I don't want to affect my shape during my pregnancy. No, that shape has to be affected. The reason is you should not lose weight when you're pregnant, or maintain weight when you're pregnant, or gain too much weight when you're pregnant, but you should gain periodically, okay? So why should you not lose weight? When you're losing weight, it means you as a person, you are not getting enough nutrients. Your baby is extracting much from your stores. So in your stores, hence, the baby will not get enough, and poor organ formation and malformation can be there. Why should you not maintain? Because there are factors which are growing. Why should you not increase much? And that's why we check weight for either reduction or gaining. If you gain too much, either there are higher chances there can be fluid accumulation, or apart from that, you are overeating. So the dangers of overeating is it can easily pose you to obesity during pregnancy, and obesity during pregnancy can affect your blood pressure. And you remember the last topic we had about obesity and blood pressure. It can affect your blood pressure because it affects different hormones, fat accumulation that constricts your veins, and then during pregnancy, there is also fluid requirement that goes high. So this fluid accumulation when you're obese can also affect your pressure. So apart from that, it can also lead you to something called gestational diabetes. It's a type of sugar issue that you get when you're pregnant. If well managed with diet and lifestyle changes, you don't require medication. But if not well managed, you require medication. And after that, it disappears after you deliver. So we'll check for the weight, and a normal pregnant mother who has the normal weight before pregnancy should gain 700 grams to 1.5 kg per every visit. So in a total, they should gain 11.5 to 16 kg on 40 weeks.
Wow.
So every visit, be key.
This is, okay.
For all normal weight,
right.
If you are normal weight before pregnancy, you should gain the least is 700 grams and the higher is 1.5 kg every month of visit. But for those mothers who are overweight, they can still gain about 600 to 1 kg every visit. That is about 7 kgs to about 11.5 in 40 weeks. So 600 grams to 1 kg.
What does it say, and who you?
Okay.
Is there a factor like that?
It differs only when you have twins.
Okay.
But no matter normal size baby, we say 2.5 to 3.5.
Okay. Okay.
So why should you always gain 700 to 1.5 kg every month? Remember, as a pregnant mother, the breast is increasing. So the breast at 40-week increases with 0.5 kgs. Then apart from the breast increasing, there is the uterus, 0.5 to 1 kg. There is the placenta, again 0.5 kgs. Then there is the baby, 2.5 to 3.5. Then there is the fat accumulation that goes to your hips and down the belly, is 3 to 4 kgs. Then apart from that, there is increased fluid volume, is 1 to 2 kgs. Increased blood volume, about 0.5 to 1 kgs, plus other factors. So when you add them all, they should constitute this. So there is no way these factors are increasing, but you want to say you are not increasing in weight. So we check for the weight gain. Then we also check for your blood pressure, the first visit. And the reason why the blood pressure should be checked every time you come in is because when a mother is pregnant, there are different hormonal factors that changes. And we have said there is increased blood volume, there is increased fluid volume. So this can affect the blood pressure. So we prevent something called pregnancy-induced hypertension. It's a blood pressure that rises above normal when a mother is pregnant. And the last time we said a normal is 100 to 120. Yes. But for pregnancy, we can go from 100 to roughly 140 and the downward around 60 to 80, 85, okay? So any pressure above the normal, higher chances of pregnancy-induced hypertension. So that's why we check your pressure. And then, if pregnancy-induced hypertension is not corrected, it can lead to something called preeclampsia. Now, this is whereby the pressure goes above normal, and now there is kidney functions are impaired, and there is breakage of protein now in your urine.
Right.
So there is preeclampsia. Then it can lead to something called eclampsia, whereby now this pressure is too much, there is breakdown of protein, other factors are affected, where the mother is starting having things like these seizures or epilepsy and can go to coma, where we can lose both the mother and child. That's why we check on the blood pressure. Then we'll also do your urine checkup whenever you come. So urine checkup, we check on urinary tract infection. Because when mother is pregnant, there is change of pH down there that can lead to urinary tract infection that can cause a problem down there, and apart from that can cause to miscarriage. Then there is also protein in the urine to check on now how the pressure is and chances of preeclampsia. There is also glucose in the urine and other factors. Then after that, they'll do whether your checkup, whether you're positive or not on HIV, serostative status, and then send you to the doctor gyna, who will also still examine you through ultrasound to check position of the baby is okay, the uterus is okay, the walls, the baby is well positioned, and other factors, examination, pelvic cervix examination, and all that. Then after that, doctor will give you just supplements or medication depending on that. Okay. So test will be done depending on the complication that you had and how you're faring on, which are very important, and that's why as a pregnant mother, do not miss your clinic. Yes. Yes.
Keep on going.
Keep on going.
Right, we have some questions here. Remember, we're also going to talk about breastfeeding in just a short while. Here, Makori Wakiba says this: my girlfriend has breasts of large surface area to volume ratio. How can I feed her for her to be able to produce enough milk for my baby, who I'm expecting in a month?
I think the girlfriend.
Yes, and I think
feed the baby or the girlfriend.
No, I think the girlfriend already has
larger breast.
Yes, and you said, of course, part of the increase is also the breast become larger. So he's worried about milk production. I don't know. So
we have something called galactagogues, so hormones that help in production of milk. One called prostaglandin. Okay, the name and oxytocin hormone. So prostaglandin I've forgotten the name of it, okay. So the hormones, these two hormones, are necessary for breast milk production. So they start, the galactagogue hormone for breast milk formation start at around 3 months of your pregnancy. So, and we say the breast grows larger. So I would wish, I think the question is much geared after delivery.
Yes.
Which I think after delivery,
it's
then
about a month too.
Yes.
Yes.
So when the mother is pregnant, don't need to worry more, because despite there can be milk oozing, yes, but apart from milk oozing, you should not be worried about it, because it's normal due to hormonal changes. But after delivery now, when there is poor milk production, there is a nutrition that will put you on. And one thing is proper latching of the baby, proper positioning, make sure your back is well rested. Apart from that, you properly position the breast milk to the baby's mouth and everything. The baby is well positioned on the latching. Apart from that, skin to skin touch, and then foods that you can eat, a lot of fluids, soups, water, milk, because milk generally is fluid. Then there are food that stimulate milk production, and mostly these are things like the plant proteins, the green grams, the njais, then the chia seeds. Then we also have things like pawpaw, carrots, beetroots also tend to stimulate breast milk. So we'll try a bit of the diet. If the diet fails, let's say in 1 week's time, then we'll give you nutrition supplements that are made periodically to help in breast milk production. There are several of them in the market,
yes,
but we'll give you one that is scientifically proven to help in breast milk production, and we'll put you on it for some time as we monitor you and as we teach you on latching. Yes.
All right. So let's take a look at the next question here. I hope, Makori, you got the answer, and all the best to you in 1 month. One of the newest dads in town. What do I do to my cracked nipples in my first weeks of breastfeeding?
So cracked nipples is one of the areas that can easily impair exclusive breastfeeding. And exclusive breastfeeding, every mother who has given birth to a child should breastfeed the baby up to 6 months. So anything that endangers that, and reason is it's only the breast milk that has all the nutrients required for the child. It's only breast milk that is healthy for the child without bringing any infection or disease to the child. And it is complete and sufficient for the baby. So you should exclusively breastfeed for 6 months, and anything that to try to impair that, we tend to correct. So cracked nipples, the one thing that you should do is they say you can massage it, okay? With, let's say, with some warm towel, a bit of it, and then apart from that, you left it to dry a bit on the sun. But it's not that, if it is very cracked, then you cannot breastfeed the baby. So you can either massage it, apply, if it is worse, there are medication that you can be given to apply so that they are not that cracked, okay? So just a bit of massage, they say the saliva, some people say you apply some saliva of the baby and all that.
The breast milk as well?
Yeah, actually the breast milk as well. So there are several criteria, but it's managed depending on how cracked is it? Yes, generally.
Right, so you can get medication or use the natural method and thing. Flora has this question. Flora is asking, my child is 3 months old. She skips 2 days without going for a long call. When she does, it's not loose as it used to be during the early months. Is she breastfeeding enough?
Now, a child between 0 to roughly 6 months, during the day should be breastfed every 3 hours. So even if this child is sleeping and they have slept more than 3 hours, wake them up, because or else they won't be sufficient of milk. So they say the child is 3 months, but
skips 2 days without going for a long call.
Yes. So a child between 0 to 6 months can even take 6 or 7 days without going for a long call. That is normal. So long as when you touch the tummy, it's not very hard. It is, I will say it's tender, and the child doesn't show any symptoms of discomfort, and discomfort is either crying or uncomfortable. So if the child is not uncomfortable, is not crying, the child can stay 6 to 7 days, and as long as when the stool come out is within the normal consistency. So it can be slightly lighter, it should be hard, it can be orange, it can be greenish, dark greenish. Those are still healthy colors of the stool. You should only be worried of the stool, it can even be whitish. You should only be worried of the stool if the stool is very hard. That is constipation. So in a constipation, we'll tell you to breastfeed more, or we'll give you medication for the baby, such as probiotic or medication that will tend to help the baby open bowels, and if it is worse, then there are also medication to tend to loosen the stool.
Yes.
So, yes. Yes, so the only thing you should be worried about, if it is mucus-like and faulty smell, that is high chances of infection, and the mucus-like and loose that goes 3 days, then you should see a medical, you should go for medical checkup, or when it's hard. So, more fluids, just keep on breastfeeding the child. The child is okay.
So long as there's no discomfort.
Yes.
Yeah, I remember wakati mitoto yetu ilienda siku 4 bila kitu. Lakini on the 5th day, kakafunga. All right, let's take a look at the next question here. Somebody asks, I want to know how to deal with the low production of breast milk after eliminating stress as the cause. So, probably alikuwa place yenye kulikuwa na stress, sasa eliminate, there's no more stress. So how do you deal with it?
So stress is one of the factors because it's an hormone, and when stress is high, it affects the hormone for breast milk production. So make sure you're stressed, and that's why whenever you're breastfeeding, we tell you sit and back supported, because in that situation you'll be relaxed. And then, as we have said, proper positioning. So I would have taught how to position a baby on the breast milk. But that is another topic that can take time. You can check the procedures of proper positioning. Either on your YouTube, it's there. So proper positioning, whereby you ensure the lower lip of the baby open outwards, okay? And when you put the baby on the breast, the breast, let it be supported. Don't leave the baby to support the breast on their own. You are washing plates and the baby is breastfeeding. And then make sure you see the darker part, the areola, the darker part more on the upper side, on the lower side. And to ensure that you know that the baby is really breastfeeding well, there should not be sounds like that means you're not really positioned well, and you should not feel that pain when the baby is breastfeeding. But as we said, the chia seeds, flax seeds, and even the moringa itself, it has several amino acids. Actually, it's a very good plant that I advocate. Then apart from that, we talked of the plant protein, the green grams, and all that, a lot of fluids, and many more. But if you try that and it has failed, we have popo and all the rest, and it has failed, then we tend to give you now supplements. So you can still come and see me at Mata. I'll prescribe for you something that will be able to help you and assist you.
All right. Speaking of Mata, there's a shout out from, his name is Ken the DJ. He says a big shout out to you because you really helped taking care of his late mom.
Ken is a good friend. I remember him.
Yes. So shout out to you.
Thank you, Ken. Thank you, Ken.
Here's Okioi, who has a very interesting question here. He says, my wife is pregnant, but she eats a lot. How can I assist her?
Okay. So there is eating a lot during pregnancy, and then there is cravings during pregnancy. Where Willis mama nakuamusha nataka kuku fry.
Kuku choma.
Ile kampuni sahi. You get it?
Kuku.
Or nataka soda baridi.
I don't know if you're allowed to say kuku pono. But nataka hiyo.
So cravings, yes. So cravings are much due to hormonal changes during pregnancy, and one of the hormonal changes that are affected during pregnancy is a part of the brain called hormone called leptin that controls hunger generally and how you feel full and appetite and all that, okay? So this hormone that controls appetite, there can be interchanged or affected when you are pregnant. So craving are not anything to do with the pregnancy. It's much of the psychological setup of yourself. So it's something that you can control psychologically.
Yes.
So it's not anything that is pregnancy causing. The only two that we said is eating stones and soil due to calcium and smell of things due to iron deficiency. But the others are things that you can control. Now, too much eating is just one, you need to know what are the right portions during your pregnancy so that you don't go beyond. And it may be you taking longer before the next meal, because when you take longer, you'll be more hungry.
Right.
And that's why we advise on small, frequent meals, because if you take too much, this same digestion is going to produce energy, and energy go to your system too much, excess of it. And this excess of it, as we said in the second trimester, there is also insulin sensitivity.
Right.
So can pose you to diabetes, or also affect the baby's fragile pancreas, and you lead up to having a baby having type 1 diabetes. And that's why we contraindicate and tell to advise mothers, do not take the sugary food, the sodas, the cakes, too much of them due to cravings when you're pregnant. You're predisposing yourself to these conditions. And there is also a danger, a baby who is born obese or overweight, they have...
this can happen when they're born?
Yeah, they can be born bigger than normal because that excess energy.
Oh, wow.
Okay, so when that happens, Children born overweight or obese.
Overweight would be what now? Above
3.5 to 4, okay?
So above 4.
Yes, and they don't tend to manage that weight up to 6 months of age or up to 1 year of age, can affect the brain development. So these children tend to be slower than normal, and then apart from that, their retention is limited. So this is a child you'll want to be number 1, but they can't, because after 1 hour, the brain is shut down. And that's why we said when a child reaches 6 months again, check what you're feeding the child so that you don't affect the child's weight more above the normal. And that's why we have the cards for measuring weights.
Right.
So on the red line is severe malnutrition. The upper red line is moderate malnutrition. Between the 2 green lines on that weight chart is a normal weight. Above that is overweight, obesity, and very obese. So when your child starts going obese, you need to be cautious because we don't want that overfeeding. So how can you help that overfeeding? Small, frequent meals. Take breakfast, maybe a cup of tea, 2 to 4 slices bread, a cup of tea, 1 to 1.5 fist size nduma, or you can do a cup of tea, 3 serving spoon gidrori, or a cup of uji, 1 boiled egg, or a cup of tea, 3 slices bread, 1 boiled egg, or with a fruit. At 10, take a glass of milk, or a cup of uji, or a glass of yogurt, or a fruit. Then take your lunch, a feast, or 1 feast size ugali, 3 serving spoon rice, 1 to 1.5 chapati, 1.5 cup mokimo, 3 serving spoon beans, dengu, kamande, and all the rest. 1 palm size or 1.5 palm size fish, 1 to 2 drumstick chicken, remove the outer skin, and about 2 serving spoon vegetable to also prevent you from constipation that comes during pregnancy, and then also increase digestion of energy, and then water 20 minutes after a glass to control your pressure, remove excess sodium, control your sugars, and general.
Na
saa 10 na usiku.
Saa 10 na usiku. We have another question here, which has been asked. Many people also ask this question, and this is it. What's the best substitute for breast milk, especially for a mother who's now under medication? Okay. Now, when a mother starts having insufficient breast milk, let's say at an early stage, 3 months, okay, it's not yet advisable to go for food for the baby. Some go for uji at 3 or 4 months, or start feeding at 4 or 5 months. What is the danger of that early feeding before I answer that question? The danger is this food that you're giving, the digestive tract of the baby is not fully formed. So the muscles are still weaker. So moving that food will be difficult, and high chances of piling up. The baby will feel full most of the time. Poor feeding that will lead the baby to not to gain weight as expected. Apart from that, constipation can occur, or irritation of the stomach of the baby, or irritation of the stomach lining because this food is cozy, and can lead to, because when there is irritation, it opens gaps for bacteria to get in. So you can have bacterial infection for the baby. And that's why children who are exclusively breastfed for 6 months and then up to 2 years have lower chances of having asthma or pneumonia, because they get enough vitamin A from the mother, and their epithelial cells, the cells of the small intestine, are well packed so that the bacteria don't get a chance to enter, and the lungs are well lubricated, so pneumonia and issues are less. So if a mother is not able to have enough breast milk during this age of 0 to 6 months, then we advise you do not give cow milk, because cow milk is contraindicated for children below 1 year. That is under American Association of Pediatrics. Should not be given to a child below 1 year, and below 6 months is even dangerous, because it has high protein content that can lead to allergic reaction and eczema, and too much protein during also these early stages can lead to early obesity and lifestyle diseases such as cardiovascular disease. Then apart from that, too much calcium that binds iron, and iron is required the first 1,000 days up to 2 years for brain development. And apart from that, it's not safe because the hygiene of it not good for the child. So brucellosis and some other intestinal irritation can happen in bacterial infection. So cow milk should be started at early as a 10 month or 1 year. But Willis can tell me I took cow milk and I'm okay. Your gene and this children's genes is different. And that's why you used to be given uji until you are covered. Yes. Try for your daughter or your son today. You run them to the hospital. Yes. So now for these mothers should have breast milk substitute. There are several formulas in the market. And that's why for any formula prescription, go to a nutritionist or a pediatrician to prescribe, because children are given formulas depending on how the child is. What about those who wanakata formula? Okay. Before tuende hapo,
There is formulas for those children who have allergic reaction, eczema and all that. It's different from a normal formula.
Oh, okay.
There are formulas for children who are having constipation, different. There are formulas for children who are having regurgitation or vomiting. It's again different from normal formulas.
So it's not a one size fits all?
No, formulas are different. Okay. And then the brand also, there are brands which doesn't have scientific proof that the content in their product is what is there. So the best formula, the criteria we follow is something called a FAS. It should be affordable. The child should be able to fix it, not to throw it, as you are saying. So affordable, feasible, accessible. It's something that you can access because there are formulas you can get in USA, you cannot get them in Kenya.
Right.
So affordable, feasible, accessible, and sustainable. Your money can sustain. And for us to advise you on the best formula, you come to us. So for those child who is due to either component in that product that is high, that the child doesn't resonate to, but we can give an alternative. So the person there can still look for me. I'll be able to assist on how to do that. And in rare cases now, you don't have money for formula, you don't have money for anything, then we tell mothers to take a more easy to digest milk, either goat milk or camel milk. But because it lacks some of the nutrients, the dilution part also come in, where it's normally 1 to 2, 100 ml of water to 200 ml of milk. But that still state you should not give pure water for a child below 6 months. Okay, it will interfere with nutrient intake. And apart from that, we also give breast milk fortifiers. So you fortify that. You can either use it on breast milk if your breast milk count is low, or you can use it in such goat milk and camel milk.
All right. All right. So another question here: what will happen when a woman suffering from anemia gets pregnant? Will she have complications?
Yes. So the first thing when you're suffering from anemia, it's good before pregnancy. You have already known you're suffering from anemia.
Right.
So you should not, I always tell clients, do not look much on your symptoms. Try get the cause of why are you suffering from anemia, so that it can be corrected, it can be. And one of the reasons people suffer from anemia, it can be severe malaria or parasite infection. Apart from that, it can be long-term menstrual period that is causing you to lose a lot of blood. And apart from that, issues to do with fibroids, sometimes women have anemia. So, and many more. So check why you're having anemia. Is it a bleeding anywhere? And then you should be on medication prior to your pregnancy, so the iron levels are up to the core. And then now when you're pregnant and you're still having anemia, you should be done hemoglobin level checkup oftenly.
Right.
And if the hemoglobin is low, that's why we said you'll be on iron medication according to the dosage of the doctor, depending on your iron levels, and also iron-rich food that we have talked about.
Right.
Yes.
All right. So we have, I don't know if you have any more, or because I also see time. Inatudunga ile kitu inaitwa kisogo. But hey, someone says our 11-month-old girl has started refusing food and only enjoys being breastfed. Any assistance? This is 11 months. Alishawiniwa, akaanza kukula, sasa amesema enough.
Yes. So we always say from 6 months to 1 year, or immediately 6 months, start complementary feeding. Nowadays, we don't call it weaning, because weaning mothers were trying to avoid breast milk. But complementary, it's to complement the breast milk. So a child between 6 months to 8 months requires 600 calories.
Okay.
So this 600, 400 should come from the breast milk. So food only gives 200. Okay. So 200 is like a full cup of food, uji for a day, because a cup is 80, a full cup is 160, okay? So a full cup and some meals. So when the child is refusing to eat at 11 months, is maybe change of that, because an 11-month-old should eat a family food. The only thing, it can either be mashed, but chopped, but protein is there, vegetable is there, starch is there, na bado inakarangwa na nyanya na kitunguu. So the appearance of food, is it the food that you give daily? But for that, we can take history. When did the child start refusing to eat? And we can be correcting it. Here will not be enough, because that is now treating something that is there. The person can still come and see me at Mata, and I'll be able to assist.
Yeah, pia kuna matrix. Yenye tunatumia, unaweka tu chakula ya mtoto kwa plate yenyu. So mkikula anadhani anakula.
Yes, that also.
Yeah, that could, yeah.
Family
kind of food.
That encourages the child.
Right? Okay. Is taking tea from tea leaves good during pregnancy? Because I'm really craving it so much. That is one. I think you mentioned about caffeine.
Yes.
I just want to read the other two as well, so you can answer all of them. Okay. So the first one is about tea.
Okay.
Let's take a look at the second one. What are the effects of alcoholic drinks on a pregnant mother?
Okay.
And finally, the third one, what supplements can I take after delivery while breastfeeding? So number one,
So
tea.
number one, tea and caffeine are
Yes.
stimulant. They can stimulate your blood pressure and higher chances of pregnancy-induced hypertension. Number two, caffeine and too much tea leaves can really bind iron to prevent that absorption. And not much studies have shown, but too much of it can also weaken the cervix, similar to too much pineapples during pregnancy are not also good. Now, do not take too much tea leaves when you're pregnant. In moderation, coffee is an X, but tea in moderation just for color change.
Why is coffee an X?
Because it's a more stimulant than the other one.
Okay.
Yes, and issues with acidity can also erupt and all that.
Okay.
Now, the next question is about
alcohol.
Now, alcohol is contraindicated during pregnancy because apart from that, it's also a strong stimulant. But there are also bad malformation that can happen when you take a lot of alcohol. Children who are very hyperactive, okay? Poor brain formation and so more can happen. So there are so many complications that can arise to alcohol during pregnancy that are contraindicated during pregnancy.
People always talk about, oh, you can have a glass of wine. There is a famous brand, I can't mention the name.
In Ausha Tumbo.
Yeah, in Ausha Tumbo.
Yes. So I would say there are no science to that. Right. Wine is not as strong as the others because we say wine helps in digestion. But we said for pregnancy, maybe we can say half a glass in a sitting, but I wouldn't really tell mothers to drink. Yeah. It's wrong.
Right.
Yes. Right. So lower volume might not affect more, but the effect will still be there on your baby.
Right.
So I would wish every mother want a healthy baby. So that is similar to smoking. So smoking will give a short nose ridge and mouth ridge, flat face, and so many more. A baby born in such issues. So we should really try to avoid smoking. Even those who smoke bang during pregnancy, just try and avoid. For your baby, keep it for just 10 weeks. Then after that, we can check on it.
After 10 months.
Yes. So the other thing, there was another question.
The last one was Ibrahim Kumbushe. It was supplements, yes?
Or supplement after delivery.
Yes.
So iron supplement, depending on your iron level, can continue. Calcium supplement can continue, but under prescription. And the other one, vitamin C, but also under prescription on the dosage. The omega-3 can still continue under dosage and prescription. Mostly, they're just those ones. The others are depending on your system and what you lack. But none of them can be given without a prescription. But all foods rich in them should be taken. Yes.
All right. Well, unfortunately, time has come to an end. But Felix is always available, and he's going to tell you where you can find him. And also, you know, like you said, I like something you said there in the beginning, that something that may be working for you and your baby or yourself during pregnancy might not necessarily work for somebody else. So it is very, extremely important to treat your case as, always treat your case as different, and seek the help and nutritional and pediatric help, depending on your position, as often as you can. It's very important. Felix, where can they find you?
You can find me at Mata, and at Mata for our pregnant mothers, I'm always in Shujaa Mall. So in Shujaa Mall, we have a gynecological clinic where I'm present as a nutritionist, and we have a gyna on Mondays. Then for pediatric, we have a doctor also on Tuesday in Shujaa Mall. But for pediatrics, for gyna in Buruburu, you'll find me on Tuesday. Then for pediatrics in Buruburu, you'll find me on Wednesday, and also gyna in Main Hospital on Thursday, okay? But in Main Hospital, we also have gyna and MCHC clinic going on Mondays and Fridays, and also even on Wednesdays. So all through, you can get our gynas on board. And then you can also get me in Main Hospital on Friday that I can also handle you.
Right.
And also even refer you to one of our best gynas who will help you in delivery, either within our facility at a good cost, at a good package that will give you, because actually for those who knew maternity being expensive, we have reduced the package. So don't worry about the package more. We are now less cheaper than before because we felt the economic strain that our people are having, and we found it better to reduce our package so that you have healthy babies being born at Mata, and we'll celebrate you.
All right. And also on Facebook, you can find him at Felix Lance.
Yes.
And also on Instagram, Felix the nutritionist.
Yes.
Yes.
So Felix Okoth,
Kenya. Yes.
Yes, Kenya.
All right.
Yeah.
No, yes, sir. I hope that you got some information, and if you missed the show, you can catch it later on YouTube. Imerudi wadao iko, and despite what you saw, it is there. You can catch it there. And then also, I want to end the show today by celebrating I say a relative of mine by extension. A big shout out to Wairongi Shalom Njeri, who was in SCK St. James Academy in Kiambu. She was the best girl in that school, and she got 407 marks. Congratulations to you, Wairongi. Shalom Njeri. Hey, Toto Asiwa. Yes, congratulations to you. Keep on shining. Tunaku celebrate on behalf of Mimi na watu wa Citizen. What? Congratulations to you. All right, we'll see you again here tomorrow. Tomorrow we eat. We'd always try to take the advice Felix gives us today on nutrition and apply it tomorrow. Last week tulikula samaki, omega 3. Yeah. Omega 3 ilikuwa pale.
Uko sawa.
Sindio? Thank you very much. All right, guys. Thank you so much. Have a beautiful day ahead of you. And successful people look like you. And that is what God wants you to know.